my name's Cheryl Talent and I'm president of the Eczema Association of Australasia. And we are based in Brisbane in Australia, and I came into this role as a patient. I had really severe eczema that I was struggling to manage, and I started working as a volunteer and found out so much information which helped my own skin journey. And that was something I wanted to share with everyone else. So I've got a real passion for talking to people, for letting them know that even though we still don't have a cure for eczema, there's some really great ways you can manage your skin if you're struggling. And, you know, we're a patient support group. So we have a free call number. You can visit us online or our social media channels. And we put out lots of tips and lots of information. Or if you just want to have a chat to someone, you know, sometimes you're just having a bad day and you need to go over your daily routine and maybe tweak a few things. There's always someone on the end of the phone that's, you know, really sympathetic to what you're going through and perhaps can give you a few pointers, you know, to try a few different things or tweak a few different things. We develop a lot of resources for eczema. We have a magazine and lots of other stuff. So it's really worthwhile becoming a member of our association. So not only do we support patients, we support the people that care for them. It's really important that caregivers have the right information. You know, some eczema patients have disabilities, you know, others are really struggling with their mental health. So, you know, it's really important as a caregiver that you support those patients in every way you can. And we have lots of resources that, you know, we let parents know, caregivers of elderly people, all eczema patients, you know, we can really help them to manage the patient they're looking after, manage their skin condition much more effectively. It's really difficult when you're an eczema patient. Intimacy with people close to you is very, very difficult at times. Of course, it depends on where you have the eczema, but even if you have eczema on your extremities, people touching you, people doing things around your house that can impact your skin can be really, really hard to live with and make your life even harder. So it's important to teach the people around you what things work for you, how they can help you in your eczema journey. I mean, I remember when my hands were so bad, I could hardly use them, and going to the shops and handing over money and people staring and making comments was one of the most awful things I've ever experienced. And I can't imagine having eczema more widely spread and having to deal with that. Unfortunately, people, when they've got eczema really badly, they shun social situations. They tend to stay home and even shun their own family. Often you'll find that they'll spend a lot of time on their own in their study or their bedroom. And it's really bad for their mental health. It doesn't help them cope as well as we want them to. We all need to be sociable, and we all need to learn how to cope with dealing with our skin in more public situations. So it's really critical that you and your family or your caregiver obtain the right information to help speed up that process. We want all eczema patients to just try and live a normal life, see their friends, go out, you know, do all the normal things that we love to do that really makes life worth living. So one of the biggest challenges when you're talking about intimacy with eczema is learning how to adapt. So if you've got a skin problem, being close to people is very challenging. It can make you hotter. If you're hotter, then you get itchier. But there are ways around this. You know, you can try and pick an environment that's you know, conducive to your not making your skin worse, if you like. Talk to your partner if it's a partner issue about your problems, and there are ways you can work together to overcome these problems. At the end of the day, everyone's journey is different and their intimacy problems are quite different as well. So it's really good to talk to people who can give you that sort of assistance that you need. I mean, we have sheets in our organisation, in educational sheets, that give you some tips on how to go about this. As I said, for each person it's different. And it can be one of the most challenging things. We did an article recently that we published in our magazine that talked about, sometimes it can actually be helpful to have a partner who has eczema because they totally understand the problems that you're having. So, educating your partner about the issues that you have is one of the key ways that you can really manage those intimacy problems. When we come to intimacy with a partner, education is key, but one of the problems with having eczema is your own mental journey is such an ongoing steep climb that, being able to manage it yourself mentally and then trying to make your partner understand can be really, really challenging and difficult. So people who get, good management of their eczema find the intimacy issues just seem to dissolve, but others that are having a real struggle with their eczema can find that it can be quite problematic. So education is definitely the key. And recently, I think there's more online resources available which are helpful, but at the same time, they can be very confusing. So getting in touch with your local patient support group who can sort of clear up some of those issues can be really helpful in trying to explain to your partner what those problems are. So we are getting better at it. We just need to do more work. It's an ongoing problem, and that needs to involve even people like your health professionals that you visit. If they can give better information, you can actually give that to your partner to read, and they'll take notice of it because it's from your doctor or your dermatologist. Sometimes you telling your partner, they don't give it as much weight as it really deserves. So we need them to really pay attention to what we're telling them in order to affect change in your life. Look, I think I'd like to tell every caregiver, give yourself a pat on the back. Whether the patient you're caring for is having a good or a bad day, you're there for them and you're doing your best. And, just by saying to yourself, I'm doing the best I can to help my patient, it's trying to dissolve that stress that you feel in caring for that eczema patient. Eczema is one of the most stressful things to manage. And on a day-to-day basis, trying to manage a patient with eczema, trying to help them when they're resistant. For example, children, they get quite resistant to having their creams applied. So you have to find little tips and tricks, sneaky ways, reward system. I'll give you a sticker, or, I'll put some cream on the doll while you put it on yourself. I'll put it on you while you put it on the doll, and we'll have a race. So we've got to put a bit more fun back into it. Eczema is a very serious disease, and everyone gets very serious around it. We have to inject a little bit more lightness and a little bit more fun. I mean, children know you come towards them with the treatments and they immediately stress up, and then that stresses up the carer. And it's the same when you're intimate with someone. As soon as they come near you, you get quite stressed and everyone gets really tense. So we have to make it a little bit more fun and try and be a bit more relaxed. And you've just got to sit down, maybe make a list. What are the things that really work with this person? How can I make it a bit more fun so that we're more relaxed from the get-go? And then, things will go a little bit more easy.